Hello, my name is Caleb Smith, and I'm back in the Rocket Miner office to give you an update for October 21st, 2020. Let's start with the Green River Fire Department, or specifically its foundation, which has been the subject of an ongoing felony theft case. Today, Stephanie Numis, the wife of the former Green River Fire Chief, pleaded guilty to taking money from the Green River Fire Department Foundation. She entered her guilty plea today as part of a change of plea. Earlier, she'd pleaded not guilty, but as part of this new deal, she both pleaded guilty and admitted to some of the facts in the case, such as she admitted that between January 14th, 2019 and January 21st, 2020, she used the foundation's credit card without permission for personal items. While she had paid back some of the money, there was at least $1,000 that she had not paid back. Stephanie Numis and her husband, Michael Numis, the fire chief, were arrested back in March 2nd of this year. This was part of an investigation between the Sweetwater County Sheriff's Office along with special agents from the Wyoming Division of Criminal Investigations Southwest Enforcement Team. Her sentencing remains to be seen. It is somewhat conditional on what happens at her husband's, Michael Numis' sentencing hearing. He pleaded guilty in September to felony theft and wrongful appropriation of public property. He too admitted to between February 4th and December 23rd, 2019, he used money that belonged to the Green River Fire Department for his own personal use in an amount more than $1,000. Purchases included that he listed before the judge, Judge Susanna Robinson, included fuel, lunches, and tools. Right now, the Numises are out on bond as they await sentencing. The other thing that caught my interest today would be the semi-regular update from the state. Governor Mark Gordon, along with several other state officials and some other guests. The press conference actually started with a focus on elections. Secretary of State Ed Buchanan noted that we are less than 2 weeks away from November 3rd and wanted to talk about some of the steps that have been taken, especially in an ongoing pandemic, to provide safe, accurate, confidence-worthy voting. He said sanitation features are in place to protect both volunteers and voters. He also gave thanks. Said that there were more volunteers working, signing up to help out the polls this year, particularly many coming from the state employees pitching in. And for that reason, there will be more poll sites for the general election than there was for the primary election. So that's a good thing. He noted, just looking at some of the trends, said for the primary, it was about 60% voted in person, and there were about 40% absentee voters. And he said they're already seeing a greater number of participation from voters in the general election, which is usually the trend. Usually, especially if there's a presidential election, you're going to see a lot more people turning out to cast their vote. Parallel to that, an increase in requests for absentee ballots. It'll be interesting to see ultimately how people chose to cast their votes. However you're doing it. Doing an requesting a ballot absentee, dropping it off or putting it in the mail first, or showing up on November 3rd, I'd encourage you to cast your informed vote, be part of this process. Governor said it nicer than I did here, saying that it's always great to step forward and exercise our constitutional rights. The press conference then turned to COVID-19, where the governor said it's pretty obvious right now, and most people are aware of the fact that there is a surge in COVID-19 cases. He said it's not, he wouldn't even describe it as a curve. He said it is more or less a straight line headed upwards. Noted that right now, Wyoming has more cases than we have seen at any point thus far in the pandemic. with it being more widespread, anecdotally, more people have personal stories, either them or people they know. Governor said more of us know someone who's been sick and even quite ill, and more people are being exposed every day. That's worrisome because one thing that we've been warned to keep an eye on is that more cases mean more hospitalizations, and we've set records in the last several days statewide. He said that when it came to Wyoming's history with the coronavirus, for several months he was pleased that we didn't have spikes that we're seeing elsewhere. He talked about, maybe you did the same, where you look at a nationwide map and you're like, oh, see that area where it's the good color? Yeah, that's where I live. I'm glad to be there. It's a relief that some of the natural benefits we have the state, smaller population, less density, that type of stuff, aiding us and meaning that it didn't quite get a grip on our communities quite as earlier or quite to a severe degree as it did other areas. That is no longer true, Governor Mark Gordon said, and the numbers back him up. He paused and said that this is a time where we need to be thanking our frontline workers, showing them kindness, showing them support. These are many people that they've been learning lessons and preparing the last couple of months, seeing what worked elsewhere, stockpiling personal protective equipment, looking at what strategies, treatments work for the best, and just operating under it's an ever-increasing amount of stress. So when you interact with them, whether it's people in our hospitals, whether it's county health officials doing contact tracing or whatnot, he encouraged people to support them, lend a hand where you can, be cooperative, be a good neighbor. The governor noted that the pandemic has taken a toll on multiple fronts, whether that's suicides in the state, whether that's concerns about domestic abuse, impacts people being more isolated, small businesses, even our foundational industries such as coal, oil, gas, construction. He said this is new for Wyoming, as we've had a pretty good report card so far. When it comes to our surge in cases, and I don't have the most recent active numbers, so I'm not going to focus on those right now, though. We've been averaging with more than 2,000 active cases for a couple days in a row now, and I'd anticipate that's a trend that I'll see when I follow up on those numbers later this evening. In response to that surge, the governor noted that there have been multiple efforts throughout the state to address this. He cited free at-home testing is now available to Wyoming families. He said they've also directed rapid testing kits to almost all nursing homes and additional care facilities. Particularly, this is a place where we have a population that's much greater at risk than other areas. I said they've been working with setting up their school surveillance program and continuing to expand it. He also took a moment there to give thanks to the teachers and staff for doing such a great job. He also said that the state has been developing, and has submitted its statewide vaccine plan to the federal government to be ready at a time when a safe, reliable vaccine is made available. He said that, didn't give too many details of the plan, but generally he said that the first priority will go to high-risk populations, and then go on with the rest of the state residents. And you know that at this time it'd be voluntary. This isn't you are required to take this vaccine. One area that we've often heard from the governor, and he continued to focus on today, was a belief in taking personal responsibility and recognizing that our actions have impact on others. He said one of our responsibilities at this time is to be honest about this virus, to state, understand, and act in ways that we recognize that this is not chickenpox, it's not the flu, it's certainly not a cold. He said that we should be taking steps to protect ourselves and those around us. Socially distance, mask, having good hygiene, Washing your hands is good. Flu season in general, good to be safe. And stay at home when you feel sick. If you're tired of hearing people like me say that, I gotta warn you, we're gonna say this a couple more times in this video. But moving on, he said that it's his opinion that in Wyoming, we've lost our discipline and we're a bit scattered right now. He said that it's up to us to make sure that we get this spread under control. Dr. Alexia Harris, our state health officer, also spoke during the meeting. She stressed that 6 weeks ago, Wyoming was in a much better position than it was today. Back on September 8th, she said that we were averaging about 28 new lab-confirmed cases a day. Yesterday, the average was 152. And she also had, I'm not going to recite all the factors she had there. You can see the full briefing on the Wyoming PBS YouTube channel. Check it out. It's got some good stuff on there too. But talking about percentage of, what percentage of tests came back positive and other spreads. One other one I would like to highlight is that saying that in that time, COVID-19 has been reported in 23 long-term care facilities. And that's one of the reasons why, at a time why we know this is especially rough on parts of our population that are a bit more isolated or removed from others. If we're not more careful and considerate, this is going to get worse. She said that when there are outbreaks, whether it's attributed to the patients or not, visits get curtailed. The better we can control it in our own communities, the better we'll be able to access, visit, and interact with some of our loved ones on a more closer basis. We can do it virtually. I know a lot of people who had their very first Zoom visits this year. My family had a big get-together just this past weekend with my grandmother, who's been in a care facility. We got to adjust where we can, and with the hope for more visits relies on getting better control of the coronavirus. She said that, noted that we've had 61 COVID-related deaths in Wyoming. And she also stressed that in addition to looking at the numbers, you need to consider the trends. Not only where we're at and where we've been, but where does it look like we're headed. She talked about the common sense safety tactics that we've been employing in other areas. Stay at home if you're sick, unless you're specifically going to the hospital and seeking treatment. If you have symptoms, don't assume it's nothing. She cited cases where people kind of shook it off or postponed getting it, following up on that, and that led to more infections. Maintaining distancing wherever possible, wearing masks. Quote, "We know masks work. We're seeing that in our classrooms," end quote, referring to the fact that schools presently are open in Wyoming. I know plenty of other school districts across the nation right now that's not what they're able to do because of where they're at. She also said, get tested if you have symptoms or have been exposed. She recognized some people are afraid of bad news, but it's those who are worried about such a dark outcome. It'd be way worse if you don't know you're sick, you infect somebody else, and then you find out that you put them at risk. To me, if I had those two bad outcomes to go, I would do the one where, okay, I'm not happy about where I'm at, but I can better take care of myself and be respectful of the people around me. She also said, obey health orders and cooperate with health officials. Toward the end of her comments, she said, quote, "We can't be successful if people don't take simple steps to avoid spreading COVID-19 to somebody who may not be able to recover. We can't be successful if people intentionally put up roadblocks in front of those who are only trying to help." In general, she encouraged people to take action to protect ourselves as individuals, our families, our friends and neighbors, and, yes, people we don't even know. She said it's up to all of us to solve it. Then we heard from Tim Thornell, who is the head of the Cheyenne Regional Medical Center. He was specifically there to talk about stories from the front line. He said that hospitals throughout our state are feeling the stress and impact of the coronavirus. But he said, but there's hope. There are 4 tactics that have had a positive impact. And yes, you've heard several of these already. He went 1, social distancing works. Practice it wherever possible. 2, wear masks when around others. He said, and just as a rabbit trail, he said, you can have some debate about whether it's highly effective or moderately effective, but we know for sure if that masks work. And at this time, when you're facing a virus, you want to have as much defense as what you have, as what you can get. 3rd of the 4, he said, wash hands. That's something that's good general advice for no matter what season it is. And 4, stay at home when sick. And then he threw in a 5th bonus tip. He said, get a flu shot. He said, these are helpful every year. Anything that would limit doctor's visits, hospitalizations, drains on our medical system is extra beneficial this year. And he said that doing these steps help us take care of the community. And with that, we know that these work. And also just talking about the hospital's perspective, he said, as cases increase, there are going to be capacity concerns. And right now, across the board, pretty much any of these, all of our health institutions are keeping an eye on space, supplies, and staff. Many places have plans to expand the facilities available if necessary. Our Sweetwater County Incident Command Team came up with something with that, and that remains in reserve. We've had a couple months to stockpile masks, gloves, that type of PPE, personal protective equipment, and also just keep an eye on staff and trying to keep them safe and healthy so that they can help us keep safe and healthy. Toward the end of his comments, the governor talked about freedoms and responsibilities again. He says, I love this country and this state, and he lives by the U.S. Constitution. All that said, he said, when we act irresponsibly, we put our liberties, we put our economy, and we put our government in jeopardy. And honestly, I would personally add that in addition to, like I said, liberties, economy, government, we put lives in jeopardy. Whether that's speeding down the interstate or not wearing a mask in a crowded space. He shared a story that obviously had given him more than a little bit of concern and heartache. He said that a family member of a friend was a truck driver, broken down along the road and called for help. And he said the person who stopped the help not only had tested positive for COVID-19 recently, not afterwards, but knew that this person was positive, was a carrier, and was not wearing a mask, and ultimately infected the truck driver, who had a particularly rough case. The governor said, this tells me that our country, our patriotism, has gone awry. He said that this current struggle that we're facing, this is an hour of need for our country. And he said that we must come together to fight this terrible, terrible disease. He said that we can do so without compromising our liberties, and do so in a way that children will respect for generations to come. One of the cool things about history is that you can learn from it. And there's positive takeaways and there's negative takeaways. I really would hate for us to be looking back and go, okay, do you see what happened in 2020? Best case scenario, you want us looking back on like, okay, they had some trouble at the start, but they turned things around, and this is something we should mirror their cooperation, their teamwork, their dedication, their compassion. You really don't want us to be going back going like, oh, whatever you do, don't do what they did. And I guess one other thing he just gave that's in the Q&A part, the governor came back to, there were more questions about state mandates. At what point do you stop asking people to comply and you start requiring people and whatnot? And the governor knows that it's an interesting fault line when it comes to expectations and attitudes. He talked about going on a tour of a mine and having to go through the safety check first. And as part of the lecture and the prep, it was okay, do you have your steel-toed boots? Yeah, I got my steel-toed boots. Got your hard hat? Yeah, got the hard hat. Safety glasses? Check. Do you have a face mask? What are you trying to do? His point being, we require a number of these things already for the greater good. And if we're asking you to wear steel-toed boots in places where I've been at workplaces like that, and the expectation was that was stated from management, and I don't remember making a constitutional case out of it, nor I recall any of my co-workers doing so. Jokes, preferences, sure. We're all tired of these extra steps, but when it comes to compliance and doing your part for the community, call a spade a spade. Mask requirements aren't the fault line that I think that will break our Constitution. I have more confidence in my country, my government, our patriotism than that. Among the final questions, they just stressed that as of right now, there's no specific benchmark for where they may institute stricter guidelines. And part of it is that they want to have flexibility, recognize that things continue to be fluid. But Dr. Harris said, that all said, we know that we have tools that we know that work, and that we should be taking these precautions in all areas. Said that right now, a number of the outbreaks we're seeing wouldn't necessarily been curtailed by stricter guidelines like some of the ones we've seen already, seen previously with some of the businesses and whatnot being limited. She said it's happening a lot in small informal gatherings, and how we and it's on us that even though we're tired, and honestly we've got a slog to go before we're through this, but it reminds upon us to do our part. One of the things that the governor cited in his earlier comments was talking about the Code of the West. That's something we have proudly posted on the walls of the Rocket Miner. And number one is live with courage. That takes work. And I don't think and I think courage also means being prepared. I don't think you can be brave, but take precautions. The goal isn't for people to be frightened into inaction, into isolation. That honestly makes things worse. System doesn't work as well when we do that. But I would encourage you to live with confidence and courage, and take the steps that, whether the people around you are following them, whether some of these health guidelines are popular or not, make your personal choice to do what you believe to be right, what you believe to be healthy and helpful. Anyway, this is Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow. Bye.